Hello, everyone. My name is Nadezhda Greva, and I'm a part of ISTC team, and we are studying the zoonotic tuberculosis. And today, I would like to tell you about the major aspects of this problem worldwide and in Georgia in general. So. What is zoonotic tuberculosis? It's tuberculosis transmitted from animals to humans, mainly um, uh, species like Mycobacterium bovis and Mycobacterium capreae. Um, Mycobacterium of tuberculosis is the major cause of tuberculosis in humans, but Mycobacterium bovis is significant in areas with close human and livestock interaction. Zoonotic tuberculosis represents a critical public health concern, primarily due to its impact on vulnerable populations in developing countries and its diagnostic challenges and social and economical ramifications, and we will talk about them soon. So the main transmission path is consumption of unpasteurized milk or dairy products from infected animals. Another path is direct contact with infected animals. This path is common for farmers, veterinarians, and slaughterhouses or workers. And the less common path is airborne transmission through infected aerosol droplets. Also in endemic regions, poor farming practice and lack of livestock disease monitoring can also be have a huge impact on disease spread. So due to these factors, the highest transmission rates are in sub-Saharan Africa and Southeast Asia. And Georgia also it's less common here, but it's not as uncommon as we would like to have it. So approximately 44% of countries report bovine tuberculosis cases, so which is almost a 50%, like almost half of the countries in the world. 35 of the countries seeing the disease in both livestock and wildlife. Regions with these livestock-wildlife interactions and the weak healthcare system are at the higher risks in transmission of the zoonotic tuberculosis. So one of the main challenges of diagnosing the disease is its similarity in symptoms to Mycobacterium tuberculosis, which can be fever, night sweats, cough, also some extrapulmonary effects like lymph node, lymphadenopathy, any types of bone changes, some plaques in the gastrointestinal tracts, and etc. So the tuberculosis itself has its difficulties in diagnostics due to not like rapid progression of the disease, but and also it can mimic other diseases. But zoonotic tuberculosis and tuberculosis bovine is even harder. So and gives more difficulties in to diagnosing it. Also, there is a difference in treatment, and one of the challenges is that Mycobacterium bovis is resistant to pyrazinamide, which complicates, obviously, the treatment regime. Also, zoonotic tuberculosis is more likely to be present in immunocompromised persons, especially HIV positive individuals or any other congenital, for example, immunocompromised patients and disease which cause the decrease in our immune system. Also, according to World Healthcare Organization, up to 10% of TB cases in weak health care systems may stem from Mycobacterium bovis. So the problem is quite quite common, let's say. So what is the key prevention and control strategies? First of all, it's a pasteurization of dairy products. It's the main intervention against foodborne zoonotic tuberculosis. Also, cattle and livestock testing crucial in endemic areas for the zoonotic tuberculosis. Vaccination of diseased animals. The vaccination reduces Mycobacteria bovis in cattle, lowers transmission risks, and valuable in high risks areas. And also, last but not least, it's improving farm management, like sanitation, isolation of infected animals, controlled livestock movement, and training farmers and healthcare workers and like veterinarians into detecting the disease, the sick animals, the sign of tuberculosis, and also preventing, like isolating those animals and thus preventing the transmission of the disease. Another major helping point is public healthcare education. So we need to have more campaigns to raise awareness of the disease and awareness of eating like raw dairy products and awareness of how it is important to have a special regime on farm, which would prevent any anti-sanitary and prevent thus transmission as well of not only zoonotic tuberculosis but any disease in general. And also, it is essential in rural areas with limited healthcare and under-regulated food markets to create some measures and to raise awareness of necessity to be cautious buying products in those unregulated food markets. Another aspect of zoonotic tuberculosis is economical burden of the disease. The economic impact is multi-factored and it affects both the agricultural and healthcare sectors. So the direct costs include medical expenses for diagnosis and treatment, and indirect costs encompasses a loss of income from affected workers, long-term disability, and premature death. For example, in a study conducted in 2016 by Mitchell's with his co-workers, it highlighted the significant economic losses associated with zoonotic tuberculosis in cattle rearing regions, estimating that in some African countries up to 3% of the gross domestic product may be lost annually due to reduced productivity, veterinary expenses, and loss of livestock. The financial burden is compounded by the long and expensive course of the treatment for human cases, especially in resource-limited settings. Moreover, the resistance of Mycobacterium bovis to pyrazinamide leads to more to a costly treatment regimes that strain both individual and public health resources. when we talk about farm control and economic consequences of zoonotic tuberculosis, we can say that ineffective farm measures continue the spread of tuberculosis in animals, which affect exports and agricultural sector, because obviously the products of ill animals cannot be put into market. Also, those animals also need to be like slaughtered, or because it's the treatment of those animals is also quite expensive. Not everybody, especially like small farms, they cannot afford the treatment, so they send those animals to a slaughterhouse, and obviously those even the meat that we get after slaughtering an animal, it cannot be used into any into any food related like restaurants, markets, and anything like that. So obviously it costs a lot to the farmer, and to the farm household of the animal, and also into economics in general. And high costs of controlling such a disease exacerbate poverty and create a cycle of infection and economic losses. So to sum up, zoonotic tuberculosis is pressing global health that demands attention due to its impact on vulnerable population, especially in regions with close human and livestock interaction. High disease prevalence in developing countries with weak healthcare system is one of the major health and economic challenges, such as significant economical losses in agriculture and healthcare sectors. Development of rapid and accurate diagnostics method to detect zoonotic tuberculosis is in both humans and animals is what we need to focus on in future, and why we are exploring the problem. Also, one of the helping points can be an advancement of effective vaccines to prevent Mycobacterium bovis transmission, especially in high-risk regions, and exploration of transmission dynamics to understand regional variation and target interventions more effectively will allow us to assess the problem more effective. And there is a strategy which is called One Health approach, which combines and focuses on collaboration between human and veterinary health sectors to address zoonotic tuberculosis comprehensively, and to help each other, like veterinarians and human doctors, to advance the methods of detection, treatment, prognosis, and prophylactics of transmitting and of the disease, such as zoonotic tuberculosis. And here you can see some references that we used to create the presentation. And as you may understand, that zoonotic tuberculosis is a major problem that needs further assessment, and needs to we need to find more efficient solution to provide prevention of transmitting the disease, and that was the purpose of our study. And you can check some our fundings and some other in the latest webinars, which my colleagues will present. And for today, thank you for your attention.